Welcome to the Health Bridge podcast. This is your host, Holly B. Today, I am introducing you to Dr. Ardeshir Mehran. He is a psychologist, a psychoanalyst, a transformation leader, and a leadership coach. He has degrees in organizational, counsel, and quantitative psychology. He has advanced training in psychoanalysis, group therapy, and team dynamics. He has studied somatic therapy. And the subject of emotional wellness is a reality and priority for Ardeshir. In addition to personally experiencing depression and anxiety while in a key leadership role, he has heard firsthand as a coach how it impacts the performance of his clients. Ardeshir's recently published book called You Are Not Depressed, You Are Unfinished has become an Amazon bestseller in 5 different categories. It is an inspiring and practical book that will help change how we as a society understand, assess, and heal depression and anxiety. A book that will bring hope and direction to many. The premise of this book revolves around his Bill of Emotional Rights, which is basically a manifesto for lifelong human motivation and fulfillment. These rights span across cultures, across eras, and he sees them as our birthrights. So we dive in deep to the 7 different rights that he has identified through 30 years of research and study. We talk about how they are all interrelated and what do they have to do with your health anyways. We start off the conversation by speaking to the experience of the pandemic and how that shook things up over the last few years and what actually a blessing it has been in so many ways. What I really love about Ardeshir's work is that he talks a lot about the basically training us to find the body as a place of healing instead of a place of disruption, a place of depression, a place of anxiety, of discontent, finding home in the body, finding space in the body, and becoming aware and in tune of our body's responses, because all of the pain and other signals that our body has given us is all so that we can find what the body needs to heal and in turn find what the mind needs to heal. Ardeshir believes that pain actually leads to health, and I have to mirror that as well. So we'll talk about that in detail, listen into this fascinating conversation. Before we dive in, I do invite you to take just a moment to like and subscribe to this podcast. It really helps our message get out there further and affect more lives. And people need to hear these messages. So thank you for taking just a moment to do that. And please, let's dive into the episode. Enjoy. Ardeshir, welcome to the Health Bridge podcast. We were just chatting before I pressed record here, and I know that we are going to have a really amazing in-depth conversation. You bring a lot to the table, so welcome to the program.
Great. Thank you so much, Holly, and appreciate for the invitation beforehand. I love the focus. I love the energy, and I'm so grateful for your work. So I'm an open source. Ask away, and let's delight our listeners.
All right. Well, let's jump in. So you recently wrote a book called You Are Not Depressed, You Are Unfinished.
Yeah.
So let's start on this topic of depression. And you say the opposite of depression is fulfillment.
Yep.
So I'd love to hear kind of your take on what you've seen over the last 3 years with everything that we've experienced with the lockdowns, with, COVID, all the shifting that's come along with that. And, I think it was a really interesting, polarizing experience that we've all been through. Some people who weren't maybe feeling very fulfilled before COVID, this was a chance to shake things up and be able to really examine, well, what wasn't working for me, what might work for me. And then others that had been feeling really stable and fulfilled prior to the lockdowns,
Yeah.
that got shaken up. And then all of a sudden they were kind of in this space where they didn't know what was coming next.
Yeah.
And
Yeah.
that sent them more towards that kind of depression and anxiety.
Yeah.
So
Yeah.
I'm curious what you went through and what you've experienced both personally and professionally.
Thank you. Thank you. So let me answer your question by first dissecting what you just mentioned, depression and anxiety. At times they get together like a big mush of spaghetti, and we don't even know what is what, but we just know we don't feel well. So, and the whole notion of depression, I spent a lifetime trying to understand depression. When I went to graduate school, I went to psychology because I was in pain. And I'm sure some listener can respond to it and relate to that. I grew up in a family. I knew my mom is not well. My dad is not well. They were very successful individuals. People loved them. But there was a sense of sorrow, sense of heaviness. There was a sense of in eyes. I could see they are there, but they are not there. And there were family struggles, like family mess, like that six sibling, we're all hurt. And I went to graduate school really trying to see how I can be of help to my mom. Her suffering, it was a burden on me. I wanted mom not to suffer. So I went to Columbia, got my doctorate. I tripled major. And I have 4 masters. I have double major undergraduate. And I wasn't really after degrees. I was trying to understand why people emotionally suffer and why is it so hard, takes so much energy to heal. So when I was in graduate school, it was basically, we were told that you guys can do great. I lived in Manhattan at that point. You can get an office in Manhattan. You will clients that come to you weeks at weeks, year after year. Very soon you can get your Jaguar and all of that. And I was thinking, there's something weird here. I don't want people to come and see me. Why healing takes so long? I didn't believe that narrative. So I started gradually leave the field and went to the corporate environment. Before I do that, I did a very intensive training program, internship program in Bellevue Psychiatric in Manhattan. Then I started to see that when patients were coming to see me, these are people who were seriously depressed, suicidal, drug addicts, schizophrenia, that when they were talking about their illness, and if I, as a therapist, a rookie therapist, didn't try to diagnose them, didn't try to give them a code, the American Psychiatric Association code, and hear their narratives, very soon I started to realize the crazy things they were telling me, actually, there were stories of human being behind it, of things that happened to them. Their minds were not crazy. The environment they came from was traumatic, was harsh. So they had to basically numb themselves to come up with the way of thinking about the world to survive. And in that, it was the first time I worked with clinically depressed patients. And I realized depressed patients, yes, they talked about heaviness, lack of concentration, the gloom, they couldn't sleep, so on. But there was a subtle experience. They were searching for something. They were longing for something. There was a sense of loss. They felt it that they couldn't name it. So by nature, I'm a very good researcher, behavioral researcher. I listen, I observe, I doodle, and I keep notes. And so I start to take notes about person A says this, patient B says this. And later on, when I went into corporation, I became a confidant to many individuals in organization telling their stories. And I realized there are patterns to their stories. The names, the places, the context different, but people are seeking something. This became a 30-year research for me, and which in my book I talk, there's a segment about Bill of Emotional Rights, which is revealing something's been in humanity since the time you read in the Old Testament, New Testament, in the early writing of Roman and Greek philosophers. that when we are depressed, we are basically what depression means. There's some basic human needs that they didn't get fully shaped for you. There are, if you are a car, there are parts missing or parts didn't being put together. And you're depressed because you know it. You know there's a love missing. There's a sense of respect missing because your body was violated. What does violation means? That someone tells you you cannot grow. You cannot be this way. You cannot be that way. So the parts of you were shaped in a way that they were not for you. And you know it. That's why you're depressed. Depression is a data tells you that there's a part inside you that is waiting to be realized. Anxiety is different. Anxiety and depression are twins, feed off of each other, but they are very different. They feel different in the body. They're healed different. Anxiety, which is the extended stress turning to more predictable behavior, is about predictability, stability, and control. So when you're anxious, pandemic was initially was the stress, but then anxiety, that you feel the world is falling apart. You don't know, is this right? If it is that right? And all you know, people say, put this on, take that on, go here, don't go over there. It's almost to create a sense of unease within you. To this day, I have friends, wonderful. These are physicians that when I go see them, they make me go through. Every time I go to their home, I need to take the test. I need to wash my hands. I need to put the mask. So at that point has become a sense of unease that the world is an unsafe place. So anxiety and depression feed off of each other. And to your question, what pandemic did, pandemic was basically a norm breaker and allowed people to experiment with things. I don't want to go to work. I want to work remotely. So people got the permission to stick their neck out and ask for different things. Maybe I quit my job because the labor market is hot. I will find another job. And people loved it. And instead of following the rules, we were making rules every week and people loved it. It's almost like open the gate, let them out. And so there are some people who actually left their relationships, they left their boss, they left their toxic work environment because they felt I can do this. And that allowed them also to manage and redirect their sense of anxiety, get some control back. Now, I'm not going to commute. Commute, it was always bad, like, why do I do that? So pandemic, to be honest, in retrospect, yes, did a lot of damage to our society, but it was good. It was good. And yeah, so I came to this world, to this line of work, to your question, I was trying to figure out why healing takes so long. And what I learned, and I tell people, and I know people hate me for that, especially psychologists, we psychologists, we love theory. We make things up. And for everything, we have an explanation, elaborate explanation. Mental illness is not that difficult. Basically means an unfinished life. And there's a beautiful movie came about 15 years ago, Girl Interrupted, which is about a young girl being hospitalized by Winona Ryder, that mental illness means a life interrupted. Once you know what was interrupted, what was lost, you can restore what was lost. Therapy can be a lot faster, more transparent. You see the result, and the results will last longer.
That was a lot. Yes. I think you're right. And the more I've been doing this podcast, it's been a year now that I've been doing this podcast, and the more people that I talk to from all different aspects of healers, the more obvious it is to me that there are many paths to seeking out that unfinished portion or that interrupted portion.
Yeah.
A lot of people who I've been speaking with recently have been speaking to their plant medicine journeys and the science around using psilocybin, for example, or cannabis to get straight into the point of healing pain and healing trauma specifically quicker than more standard therapies.
Yeah.
Do you have any experience in that realm, or can you speak to how, you know, that path towards healing may benefit or differ from, say, the approach that you take, for example?
And the question is about cannabis or like
using psychedelics or different plant medicines.
Great question. It comes up a lot. So psychedelics can help with anxiety, because anxiety, what we know, is not in our head, is in our nervous system, in the body. Depression, many psychiatrists, they define depression as a mood disorder, affective disorder. That's how it shows itself, but is not. The core is about emotional experience unfinished, unstructured, and uneven, being unaware. So cannabis with respect to depression can change the chemistry of the brain, that you feel better, you feel clearer, you feel less heavy. It will come back again. Because depression, the way you handle depression is really response to anything with the action verb. You need to create something. You need to say yes to few things. You need to say no to few things. You need to set new boundaries. So cannabis can create a more balancing of the mood and manage the pain of depression. Depression can hurt emotionally, but cannabis cannot heal it. You need actually a way to reach and find you, and to do that. And there's some element of pain to that. The pain that comes up, this is actually very powerful, is the pain of controlling your body to numb yourself. So when we start the journey of healing, something magical happened. And in fact, some client says, oh my gosh, I didn't know it hurts working with you. And I shared with them, stay with me. Let's stay together. This is the pain that your body's been trying to numb it. It's almost like opening an infection, let the pus come out. Your body, pain is suffering being released. Once you do that, you can settle. So cannabis can help manage the pain, cannot heal it. It's your work to do that.
So let's talk about that work. Let's talk about diving into that pain. I see pain, especially with trauma, background in trauma. It's like, it's exactly actually what you said, that opening up of the wound to let the pus come out. All of that pus has been stagnating and building up in the body,
in
the emotional body and the physical body. And eventually it comes to a tipping point if we haven't addressed it yet or acknowledged it yet. So where do we start when we hit that tipping?
Thank you. Let me give you a client example. And you follow the energy. That's the question everybody asks. Where do I start? And I tell them that you don't start right away trying to unearth past trauma. You follow in here and now, and you about what the energy is. Body is almost like Sherlock Holmes. Body and pain and suffering, they want to be explored. They want to reveal you to yourself. But this needs to happen in a way that you don't go to basically aftershock, overwhelm yourself. Body, and you know this, Holly, that body healing, you need to help the client be in a state of safety, control, and balance. Otherwise, they will have relapse. They just feel awful. So a client called me, a senior woman, late 30, divorced. She attended one of my public, I give monthly seminars, share about my work for free, to share my message. She attended it, says, love your message. I'm in a relationship with a man, professional. He's passive-aggressive, abusive relationship. Will you work with him? And I said, yeah, let's have a conversation for me to understand better. 2 days later, another email came, says, you know what, forget about him. Will you work with me? So this happens often. And then what we met, her question was that I was in a relationship with my first husband, and it was a very uneven relationship, basically domineering man, more or less professional woman that he was telling me what to do, and I was really losing my voice, my vitality, and I couldn't feel sense of joy. I didn't enjoy being intimate with him. And in the passing, she said, I've been sitting on childhood trauma, back problem. I've gone to a number of doctor, MRI. They said there's nothing wrong with you, but I know my body's aching. And I said, that's fine. Where would you like to start? And I said, let's start with my partner. The second session, when we talked about, I said, Ardeshir, can you net healing for me? And I shared when we're trying to come up for healing ourselves, it's really about setting boundaries. She said, what the heck do you mean boundaries? I said, when we come up through life, especially with children of trauma, it's almost like you have a house, the doors open, windows open, anybody come in and out, and you just do whatever to get by, to survive, to be treated, to not to get hurt. Part of the healing, you need to set boundaries about who should be inside your house. That is good for you. How do you know somebody's good for you? Who do you say, you know what? Thank you. We've been together, not anymore. And who do you have a conventional? And then there's exercise I do, setting the boundaries for your body in the presence, sense of connection, sense of agency. So really what I was trying to do is helping her to find her body as a place of healing. This was second session. Third session, she wrote, says that she had a conversation with her spouse, with a partner, say that we're done. That's not working for me. And I need to find space that is not overwhelming for me to do the work. In the next several sessions, it was about trauma, which was teenage trauma, accident. She was incapacitated on wheelchair, then cesarean trauma, surgical trauma, number of body invasion trauma. Her body, as she saw it, was invaded by a lot of doctors. Anesthesia about how do you find your body healing, your body, and to let PTSD go. So some of that work was about there were pain in her body, in lower back. The reason she didn't enjoy being intimate, every time anybody touched her skin, she remembered of doctors, anesthesia, like basically overwhelming her about how do you love your body? How do you allow your body to feel joy? So part of that, we would have a session. She would just go to a local cafeteria, have a cup of coffee, cheesecake, and let the energy, the sugar, please her to find herself. So this work where you start, you help the client to own the first thing is their body. That's where home is. That's where safety is. At the level they want to go. And then gradually they go to where the pain is, where the sorrow is. And later on in the fifth session, start to talk about when she has memory of her being around her dad, and there was child molestation going on, but about sexual memory coming up that her body wasn't safe. So, but what you do is you just go at the level the client wants to go, feel safe in their body in here and now, and one step at a time, claim your body, bring joy, bring safety, and bring a sense of comfort to own yourself. So she has a different relationship with the man, that they enjoy each other. They have a better equal relationship. It's more romantic, it's more sensual. And her pain, her back pain, PTSD, in fact, she said, I'm coming off of medication. I'm not taking medication. And her back problem and PTSD has been resolved significantly.
The mind-body connection is extremely powerful.
Yeah.
And so many people, most of my clients are in the chronic health space. They have one or more diagnoses, and the majority of people in that space as well have taken years even to get a diagnosis, because they know that they don't feel right and things are not functioning right physically, but doctors can't find anything. Blood work comes back fine, other tests come back normal. And so they're in that weird space, this in-between space of, am I crazy?
Yeah.
And I think that a lot of the work that you do points directly to that space of, they are recognizing pain. They are recognizing these signs that their body is telling them that something's off, but they don't know how to address it.
That's right. That's
And
right.
we're taught in this society that we go directly to Western medicine. And I'm not saying that we shouldn't.
Mm.
There's obviously a lot of benefit there too. However, it can only address a certain part of that,
That's
you
right.
know,
Mm.
problem.
That's right. And to your point, this is so well said. Doctors, the same thing with psychologists. When you went to school, what you trained, the moment somebody comes to you, as a good practitioner, your first job is to arrive at a diagnosis. And then diagnosis determine the treatment plan, the medication, and so on. So the good doctors do that, but how they were trained. And they were trained to do that as efficiently and quickly as possible because they were trained this is how you serve the patient. So love the doctors, they are creature of their own training. I was trained as a psychologist like that. The way that work happened, and there's a fundamental science like the body, the book The Body Keeps the Score, Bessel van der Kolk by Peter Levine, father of somatic experiences. I'm trained by him. And the work of trauma research by Gabor Mate, or Stephen Porges by the vagus nerve system. My therapy from 10 years ago to now has significantly changed. So when the client I mentioned, in the past, it was verbal, great seeing you, tell me why you wanted to see me, patient history, and so on. What is different is that what you remember, your boss, your partner, your childhood, all of that, it's important to know, but it's in many ways you're irrelevant. You're here in discomfort and pain. That's all we need to know. You know that data. So the work I do is do a grounding exercise for them to settle, to feel your body, because every time you go to a meeting, your body is there, but your mind is not there. Your emotions are not there. So help people to settle and to feel their body. And there's a question I will ask. I don't ask them, how are you feeling? Because that's a very left brain cognitive expression. We know from research, we have almost a ratio of 80-20. We have more emotions than we have words for them. What I ask them is what's coming up for you. And I ask them mind, body, and soul, your entire being, your past, present, what's coming up for you? What are you sensing? The reason I ask them is body sensation and even lack of body sensation. Sometimes people say that I don't feel anything. My body is just like a big hollow. That's often, not always, the sign of trauma, childhood trauma that you're trying to numb yourself. And I would tell them, just sit with it. Whatever comes up, let's work with that. Then usually pain comes up. My shoulder hurts. The client that I mentioned, her chest was hurting and her back. And I asked her, just put your hand over there and connect with your pain. Your pain is speaking with you. What color is it? How big is it? You see motions. And then work, this is really about helping them to become integrated instead of ignoring the pain, bring it to the conversation. And then whatever memory, recall comes up, you work with that as a way for them to explore. Really, it's almost like a scavenger hunt. There are things inside your body throughout that they've been there all along. The Western medicine, me included, we were taught to just label it. No, what story is there? Whether you're hurting in your gut, in your chest, back problem, your knees, they all mean something. And invite them to see that, because that's how the true healing comes up, and then it goes deeper and deeper.
So you're speaking to incorporating somatic approach.
That's right. A lot. Absolutely.
Yeah, and somatic work is, I would say, trendy at the moment. It's becoming to the forefront of practitioners are using this and speaking to this. It's all over Instagram, and for great reason, right? It's something that's been ignored for too long. We were talking before we started recording, and you mentioned that there's a lot of somatic practitioners out there that aren't really practicing somatic work or
Yeah,
aren't
yeah,
really
yeah,
approaching it the right way.
yeah.
How do we know what's the
What's the
right
right
way,
way?
what's the wrong way?
Yeah. No, thank you. So there are some basic fundamental from the science in somatic work to appreciate. Like people talk about getting the vagus nerve system, about how to basically the resetting the nervous system. Some element of science somatic work is that brain and body's connection. More than that, brain follows the body. This is very different than in the past research that what the brain thinks, categorizes, create decision, or even like when we have intentions or like self confirmation, self affirmation. Ardeshir, you're good, you can do it, wonderful, go out there. Those head based narratives, they are only effective is if body is responding. Body responds in a state of safety, predictability, and protection. So any somatic work you do starts with the patient or even with yourself at this moment, creating environment in here and now that you tap into being more safe. And part of that, the therapist like in you, it's about how to create more atonement. And atonement is very different than empathy, that the patients feel I'm connected. Holly sees me. I can be me. I can share what I want, and I can feel safe for her. So the eyes, the mouth, and the tonality of therapies matter a lot. You need to slow down to the speed of the patient so they can find themselves. So part of that, you create safety. Then the narrative, brain narratives, it always starts first. Your work as a therapist is, as patient talks about, I just had a terrible discussion with my boss, with my manager, or with my child. Track their body, their breathing, their facial expression, their posture, and bring them at the right time in the right dose. What are you noticing in your body? What's coming up for you? What you're doing, you're inviting them to be more integrated, to be together. Then a key part about it is the changes from the past therapy to the current, what we know from neurology. Brain remembers past memories. My mom, my dad, my culture, boss, so on. Body doesn't. Body only lives in here and now. So in fact, it's not helpful to do a lot of, tell me what happened to you. What you need to do is stay with the energy in the moment and allow the patient to bring what's on their mind, what's coming up, follow the energy, allow the energy expand, and whatever then part of the memory comes up, the client decide that because they trying to integrate. Many therapists, somatic therapists, get hooked by you were a child, you were abused as a child, so that's the reason. The moment you do that, you lose the client. Client needs to do that. They need to do their own healing to rediscover their body. So you work only with here and now, and whatever body movement come up, how they're looking, the eye contact, some of the key dimensions, eye contact. Do they see you or they look at to you in a hollow way and they're trying to see what you're saying? What is the body posture? What is the breathing? Do then at times when the therapy gets heavy, you see the patients bending forward. This is a sign of they're feeling overwhelmed. Calling that out, saying that, what are you sensing in your body? Oh my gosh, oh my gosh. So like inviting them to see the body and mind and emotional connection. So they learn that because this is something they carry on their movement. When you do a number of early sessions like this, they learn about how to be with their emotions in a safe way. Then you can reconstruct what happened to you. How do you end up here? But more than that, what do you do right now to go forward? A key part of somatic that many people miss, if there are energies in the body, painful emotions. Body has no sense of time. That means the body is waiting for an action loop to close. Body is very literal. Body doesn't listen to word. Body knows action. Do something, say something, scream something, leave me, don't leave me, I hate you, I love you. The body is waiting to do something that it couldn't do in the past relationship. So in those moments, you can see behind me, this is my studio. We actually act out those versus verbalize. So people express with their whole body what needs to be said, what they want to do. So you have body memory, you have tissue memory, your lungs, your gut, your bloodstream, your hormones all come in as you're trying to create tiny bits of a new healing right here, right now.
It makes me want to take a deep breath
Yeah.
and stay connected, right?
Please do. Please do. In fact, to the audience, if this resonates, take a deep breath. Breath is always good. Breath means you're connecting. Allow the breath go wherever it needs to go.
So often when we are struggling in the midst of something, we get completely disconnected from our breath.
That's right.
We shut it down, we hold our torso tight or our stomach tight, everything gets restricted.
That's right.
So somatic work is really partly about connecting with that breath and creating more flow, recognizing what, where we're holding that tension, or like you said, what is hurting at my heart or my back or my stomach, what's going on in the moment. And that brings so much power when you are maybe not in session. Like with one of your clients, you're teaching them that when they are not in session with you, they can still do that practice.
That's exactly it. That's exactly. And what I do in the early session, the very first session, once we do initial why you're here, so on, and share, let me give you 5 points, how you're designed. Nobody taught us that. And once you know that, this work is very transparent. And I tell them, now I'm going to ask you about breathing. And here's what breathing means. We role model it together. So everything I invite the patients, I will do it with them. So there are times when we do this work, like yesterday with another client in Germany. She started to do downward dog. She's a yogist, and she put her laptop next to her face because she needed to get in touch with her body and her lower back. So you bring the body, you allow with the breathing, and then you see how it works. So you can do it on your own. So the journey of healing can continue afterwards in your own time, in small doses. You don't need to come and see Dr. Mehran. In fact, I tell people 5 sessions is good enough. Maybe we go 10, maybe 15. I don't want you to come and see me. Once you know how this works, you'll be good to go in few sessions.
That's so perfect. I really want to dive in actually to your book and to your Bill of Emotional Rights.
Yeah.
Because I think this is a beautiful place to transition into that, because this is another thing that you've created, a table, so to speak, that we can reference when we are not necessarily in session with you, right? We can look at this and say, I'm feeling balanced in this area. I'm feeling unbalanced in this area. Can you explain for the listeners?
Yeah, absolutely. There are 7 emotional needs. And as I go through them, these are not cognitive like behaviors and leadership. Am I high or low? These are all felt experiences. So the way, just in some background, I stumbled upon it. I know I was born to do this work through clinical and academic research and real life research. These are, I call them emotional rights, because in many ways they are biological. Parents don't give it to us. We are wired as beings to experience them. They are cradle to grave. Some of my recent clients, it blew my mind. They are 2 different ones, 70-year-old grandmothers, saying that my children, they want to put me in nursing home. Yes, my body's frail. I'm walking with cane, but I know there's a Serena Williams inside me. And I want to find myself, and nobody pays attention. But I saw one of your YouTubes that I want to be that. I want to feel that. So as I describe these 7 needs, and in my book, I talk about what they are, the research behind it, multiple stories of people. And also for each one of them, there's a Spotify. You can go, once you learn them, you realize they're in art, music, poetry, all around us. Nobody taught us that. So as I go through them, just let it wash over you to see how it resonates, because there's a dynamics how it applies to each person in part of life. The very first one is the need of I belong. Happens at birth, happens when we are in the womb. It's about connection to the mother or caregiver, and happens right the moment of birth. Somebody's holding us. Somebody's touch our skin, kiss our face. There's a sound of somebody says, "Sweetie, I love you, welcome," a calm voice. And as our eyes open, we see a face looking at us, smiling. Noticing details in our nose, dimples, whether we smile, whether we poop or anything like that. But somebody loves everything about us. Then we get a sense, I'm connected, belong to somebody that belong to me. You found your individuality. You go from attachment to separation, independence. So what I share with you, Holly, is basically for the textbook. It doesn't happen in the real world. We are born into this world. Happened to me. Mom is busy. Mom has issues. Mom is distressed. Other kids are screaming. So you just get whatever you can. So right away you feel that sense of connection and love is conditional, is inconsistent, and at time downright abusive or is unavailable. So we grow up hungry. We grow up needy, longing for that. I wish somebody loves me. There's a preponderance of people in this world, deep down, they're isolated. They are in beautiful relationships from outside, but when you work with them, you realize they are lonely. So part of my work, bringing us that there's a loneliness, is about didn't happen what you wanted. How do you repair it right now with yourself? And the way it shows is that people go from one bad relationship, like the client I mentioned, to the other, and the whole attachment issues. And this you see in the workplace. People do all sort of crazy things to be noticed, to be admired, and so on. So since I belong, the next one comes right after that sense of I'm boundless. This is about our bodies. Very early in our life, we are told basically to ignore our bodies. As a species, there's no such thing as mind, body, spirit. This distinction happened during the time of Rene Descartes. I think, therefore, exists. We are one being. Everything we do is integrated. But we tell children, sit there, don't be fidgety, don't use your hand, use your words, be logical, good girl and boy, talk certain things. We teach people to become cerebral, left brain, even strip everything from emotions, but be very judicious, logical, ignore what's in the body, and then sit very quietly. Later on, we go to the world of work. We are born to move, and we are told to sit. We don't even know it. So one of the outcomes of pandemic was we were forced to sit for a long period of time, and we're tired at the end of the day. The reason was there was such high level of cortisol and adrenaline in our body telling us, get up, do something. It's evolutionary. We didn't realize we were just tired. So part of the healing is that using your bodies in expressions. So the therapy I don't do talk therapy. After we do initial things, we stand up. Some of the clients, I go run with them. There are some trails around my house. We jog together. So you say, I love somebody, I hate somebody, I want to quit my job, I want to accept the job. Show it to me. Bring your whole body, bring your voice, bring your Katy Perry, I roar. Bring your whole body into expression. The next one is I am complete. I am complete is the whole notion of somatic work that I shared with you. Nobody told us that being sorrowful, ruminating about the past hurt is important, but is not helpful. We live only in here and now. That's how you're designed. Nobody's taught us about how do you heal in the moment? How do you understand your pain? How do you understand your emotional, physical pain, and to work it, to use it to put it into expressions. So part of the work is help people say that your pain is data, is expression. Use it. Don't numb it. Don't ignore it. The next one is I matter. This is about the sense of dignity, honor, sense of respect. Whether you live uptown, downtown, you're a rich person, poor person, you're this race, that race, ethnicity, you're in this world, non-negotiable. You deserve respect. Having come from corporate environment, there were a number of times you were in a meeting, conference room, people enter the room, nobody sees them. Nobody turns around and says, hey, Ardeshir, hey, Holly. There are a lot of invisible people. And we know from reporting, after reporting, there are heartbreaking pandemic of mass killing going in the United States. They're basically men. And when you read about them, these are invisible people. That they, in the last act of destruction, they basically says, see me. And they're trying to find the basic to take notice. So I matter is very fundamental, showing respect, showing same space around the table to everyone. The next one is I make. The job, whatever you do in this world. We know from Gallup research, year after year, corporations after corporations, that between 60 to 75% of US population, actually this is global, they live in a soulless jobs. They have mortgage to pay, kids in college and so on. But they do the work that they hate. They use that word. What they don't realize, and this happened to me when I was in corporation, very successful, that diminishes your joy. That's where anxiety comes in because you're not in control. You feel out of balance. You're just doing what you're supposed to do. That's where depression comes in. You feel, I don't want this. So job or not doing the things that matters to you, if you don't do that, you pay a price. This is an opportunity to find what you love to do, what you're good at it, what you calls you. The next two are very fascinating. There's a need of I am. This is about your soul language. It's about the signature of your conviction, about your message. Doesn't mean about being right or being the smartest person in the room. It's about, do people know what you stand for? Do people hear your voice? That's a reason public speaking is terrifying with people. We try to emulate, make our voice pretty or sound good versus just what you believe in. Say it as you believe in it. So the work that I do, that Katy Perry roar, and I ask people, you have a roar inside you. That's the reason your throat is hurting. Your neck is hurting. You have thyroid because you're holding emotions back. Give it to me. I can handle it. You cannot piss me off. Give me your roar so you hear it. Then you can work on it. How do you want to use your voice, your conviction, your energy? The final one is the need of I soar. There's a statement on the wall behind me by Maya Angelou. There is no greater agony than bearing an untold story inside you, an untold story. Everybody has a story. 8 billion people, 8 billion stories. Once you know your story, what are you doing in this life? Your last breath, what do you want to be remembered? What is inside you lurking? And you know it. There's soul fire in your belly. Do you know it? Use it. Once you do that, people do crazy stuff. Once you do that, you literally see anxiety, depression morphs, changes. And I tell people, once you do this work, it's not complicated. You don't need a lot of therapy. It's basically finding you. There will be a day, it happened to me, you will wake up one day, you're not depressed, you're pissed. You don't want to waste time anymore. It says, I don't want to waste time anymore. I just want to claim me and go restore you. The person that you said, someday I will do that, someday I will do that. No. You will begin doing it in small doses. And you will start unfinished you finish your work.
Like each time you say one of the Bill of Rights, I think, oh, that one is so important. And then the next one, oh, that one is so important.
Yes, yes, yes.
They're all equal.
Yeah. So let me describe, thank you, that they're equal, but not all at the same time. So at any stage in this life, today is that 12th of October. So people say that, Ardeshir, there's 7 of them. I'm already busy, so many things, family, work, dogs, all that. I say, no, no, no. There's a way they play in your life. So here's how it goes, those 7. Usually there's one that is a source of joy. Oh my gosh, I want that. I want more of that. That delights me. I get goosebumps. That excites me. House on the hill. Notice that. Then there's one that typically is a tormentor. Is, oh gosh, that hurts. That I've ignored that for so long. That brings me sorrow. That brings me sense of soul crushing. And then there's one usually gives you a stability that makes you stay steady. For example, for me, I soar gives me sense of joy because finally, after all these years, graduate school, all the struggles, I'm doing the work because I know I was born to do this work. So I'm walking toward the light that I see. The part that gives me angst is I'm literally building a new way of therapy, new way of business development, website. I'm saying, oh gosh, I suck at all of this, But I'm thinking, deal with it, deal with it. People figure that there are help over there, in terms of building a new business. The part that gives me stability is my family, my beautiful wife, son, the brothers, sisters, the golden retriever, Lucy. So gives me stability. But go with what draws you, what brings you angst, and what brings you stability. For each one of them, you don't have to think it, follow the energy. The energy will guide you, and just follow the energy. The energy has a wisdom. Whatever, listen to it and just don't overthink it. Do whatever comes up.
And the 3 of those things, the source of joy,
The angst.
and the angst and the stability,
Yeah,
those may all fluctuate at different points
absolutely,
of your
absolutely,
life.
absolutely. And that's perfectly fine.
Yeah.
That's perfectly fine. Yeah.
I relate it to yin and yang.
Yes.
It's
Yeah.
it's fluid.
That's
Everything's
right. That's
fluid.
right. That's right. And in fact, with some of them, as you go forward, you realize, oh my gosh, I just scratched the surface. I need to go deeper. Go with it. Always follow the energy. If it gets too complicated, you feel you need more checklist, more the like to-do list, the accountability group, you're overdoing it. Follow the energy. Keep it simple, keep it fluid, keep it like, what brings you joy? This is supposed to be joyful. This is not accountability. Some of my colleagues, they almost overdo it. 10 steps for each one. And says, don't do that. You suck the life out of it. Follow the joy. Keep it simple. It's got to be joyful for you.
Yes. For me, the first 2 when I was reading through your list there, the ones that I gravitated to was I am complete, being untethered from past challenges, hurt, and trauma, and I am boundless, physically active with an energized body, agency, engaged and aligned with nature. And I was contemplating the relation of those 2 because with chronic fatigue syndrome background and lupus, there was a lot of trauma triggers
Yeah, yeah,
that
yeah.
happened, as we spoke to earlier, before those diagnoses and before my health issues started. And then there's that struggle with, I want to be boundless,
Yeah.
and I'm at a point now where I'm very happy with my health. But
Mhm.
the struggle, I'm just reminiscing on that struggle of wanting to be boundless and physically active and feeling just completely constrained.
Yeah,
But
yeah,
as I've gone through my healing journey and
yeah, yeah,
felt things in my body, like you're saying, and reminisced on past traumas and done all kinds of healing work and learned how to retrain myself on multiple levels, these things have kind of leveled back into balance.
yeah, yeah, yeah.
And it's a fascinating process because as you talked through all of the different 7 points,
Yeah.
they're all so interconnected, you
You're
know?
certainly connected. Is one
Yeah.
person, like to me, your body, there's the inner wisdom we have. Somehow in the Western world, we start to trust things that we have labels for. We have narrative, we have sentences. Human being is not left brain language based. There are things you feel, as you mentioned, your body knows what to do to find balance. Somehow in our education, upbringing, health practices, we overcomplicate things. There's the wisdom. So, right, did we talk about you found your best wisdom, your balance with nature, with food, letting go, coming to terms with your trauma. You found your place, and that your body feels good. When I listen to that, it seems what you did is almost you did like gardening, pruning. No, 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 no. Just get to essentials for you. That's what healing is all about. Just get to the basics that you're meant.
Yeah, the basics, simplification, and that is the main thing that
Mm.
I've come to understand in my 20 years that I've been going through this journey
Yeah,
is that I personally, but I think the world as a whole wants to make everything more complicated. Like
yeah,
it can't be that simple, right?
yeah,
Because it doesn't feel simple in my body or in my mind.
yeah.
But everything that I've done, all the gains that I've made over the last few years,
Mm.
it all comes down to simplifying and simplifying
Yeah.
and simplifying everything. And so that's what I like to help my clients with is like, let's simplify, let's make these daily habits easy for you
That's
in
right.
your life and to
That's right.
stick with.
Absolutely. I mean, we people, we are complex. We are not complicated. That and the science loves complication. In fact, I'm a psychologist, and so I'm trained in using American Psychiatric Association, the DSM-5. Like when I read that, I'm thinking, oh my gosh, we love pathology. We love creating categories, 50 ways depression and anxiety over interact. It's fascinating. They're not helpful to anybody except like a researcher getting entrenched in like basically a lot of conceptual analysis. People are very straightforward, and you follow the energy, you follow what feels right in this moment, and invite people their intuition. What are you sensing? What you mentioned, that limiting beliefs, blocks, and barriers. What do you see? What is it coming up? Bringing people trusting themselves, because a part of the journey of emotional struggle, somewhere along the way, people told what to do, what to feel, what not to feel. They gave away their power of wisdom of healing. So part of the work you're doing, saying that you can figure this out. I give you some tools, some basic language, but you can figure this out. And me, Holly, will guide you through this.
It's true. It's putting the power back in our
Yeah,
hands instead of feeling like we always need to go to that person with letters after their name
yeah,
to
yeah.
tell us the
Yeah.
answer.
That's right. That's right. Absolutely.
Creating agency in our own life, you know?
Exactly. Exactly. Absolutely. Yeah, that is so true. And I love what you mentioned, Holly, about limiting beliefs. I don't even know where to start, but limiting beliefs, somebody somewhere, psychologists, medical profession, bosses, bad partners, so on, they tell us what we need to feel. And we start to believe it because we're all good people. We are good social creatures. Part of this work realizing it's almost invisible shackles we are in. It's almost like it's really busting out of prison. I'm done.
I love the way you say that. And that I kind of think it brings us back full circle to where we started, which
Yeah,
was with the pandemic and
yeah,
this sort of busting out of the norms.
yeah, yeah,
And and that just goes right along with it. We are learning to think for ourselves again. We are
yeah,
learning to question things
yeah.
that we've just assumed prior was
Yeah.
factual.
That's
So that's when I work with limiting beliefs with my clients. We start, my word is curious. I've realized that is my word of the year because it, inviting ourselves to become curious about those automatic thoughts that we have in our head, or those automatic truths that we just assume are true because that's what everybody says is true. Be
Yeah,
curious about those things.
yeah,
Question those things. You might still find that you do find them factual or
yeah,
truthful,
yeah,
but you might not.
yeah, yeah, yeah.
And it
That's right.
opens up to new conversations and new
That's right.
learning and new possibilities just by
That's right.
asking the question.
That's right. And part of that, building on that, in the limiting belief, and when you usually happens in this starting second therapy session, as people talk about something about the, can I leave my partner? Can I leave my job? How do I talk with my daughter? I need to set boundaries. As those limiting beliefs come up, I invite them to pay attention how your body is at the moment. Because when we go to those edge work, we're trying to limiting beliefs come up. There's several things happen in the body. Our breathing happens, becomes shallow. And we get tight. That's it. I need to go fix the situation. I need to tell somebody I'm right, you're wrong. Like I need to basically defend myself, or I need to. So all of this, bodies start to get in certain ways, whether you get in your tummy, in your heart, in all of that. So I invite them, just notice and notice as it comes up, what else come up, and what voices do you hear behind limiting belief. You say, I need to go talk with my daughter. What else, who else voices you hear? Darn it, that sounds like my mom. Like it's or just I was a little girl and I wasn't just like her. So knowing how your body gets energized or revved up, because we can only change to the edge of our body being open. Otherwise, body will push back, and physiology always wins over psychology. So, like you creating more opening with your body, breathe more, as you mentioned, let your body settle. Now, look at that, talking with your daughter one more time. How can you do that but bring from the space of love that she's a teenager. She's doing the best she can. You're doing the best you can. If you go in there with love, nobody has to lose, nobody has to win. You're just having a conversation. Right? So just this work, to be honest, I'm grateful the universe allows me to do this work. I'm just, it just, in some ways heals me. I wish when I was struggling all those years, in my dark years, there was somebody who could have done this for me
This was your path to take so that you can learn it.
and learn it. And then I suffered so much that when people come in and says, I get you. I get you. I don't do psychology on you. I just do a human to human.
Ardeshir, I think that's a great place for us to close. Tell us a little bit more about your book, where they can find your book and where they can find you, watch your videos,
Thank
etc.
you. Thank you. Thank you. So my name is Ardeshir Mehran. You Google it. You can go to my website, ardeshirmehran.com. And my book is available on Amazon. Came out end of May, became Amazon new release bestseller in 5 categories, which I was shocked. I thought my sister and my wife will buy a copy and call it a day. I didn't expect that. And really, the essence of the book is that introducing you to yourself. And I talk about trauma, that when trauma happens, what actually happens to us? And how do you understand that? And how do you revise it? There's a chapter about what actually is depression and anxiety and what is the different ways. Those Bill of Rights are there. And it's a very personal book that every chapter will talk about what it happened, how it happened. And I've written it for people like us. There are some comments came to me, they're on the Amazon review. Some people wrote to me directly and said that they were praying for death, for suicide, and this book helped them. So please use this book, enjoy it. If you love it, let me know. If you hate it, let me know. But I'm here. I didn't talk about this, but there's a purpose to my life. And my wife and I talked about it, that when I die, I hope they allow me to put this inscription on my tomb. He helped discover the cure for depression and ease the suffering of millions. That's why I'm here on this earth.
Mhm. That's beautiful. I have nothing else to add to this. That's so beautiful.
Thank you. Thank you,
Thank you,
Holly. Thank you.
Ardeshir.
Thank you for this time to be with you. That I want to get to know you more. I mean, you really touch my soul, my heart, and to sending my love and admiration to your audiences who take time to listen to your podcast. Thank you. Thank you for your time.
Thank you. I love the work that Ardeshir is doing. It speaks so true to my heart and to what I believe about healing. He believes, and he said in the podcast that healing shouldn't be hard. We make it so complicated, and we need all these different diagnoses, and we need all these blood tests, and we need people to tell us what's wrong with us. Well, to an extent, some of that can help. It can help guide our direction. However, when we get too caught up in that diagnosis and what all of that means about us and says about us, we take that on as like a badge or as like a statement of who we are. And that is what both Ardeshir and I really want to get across, is that your diagnosis does not need to define you as a person, as a soul, as a living being. There are ways to experience what you're going through without letting it dictate the trajectory of your life. May it alter its course? Sure, absolutely, but it doesn't need to define who you are and what you are capable of. In fact, it can open up so many more possibilities if we allow it to. So, I want to leave you with just that little thought. And again, invite you to reach out to Ardeshir. He is an open book and has so many valuable resources available. Please get his book. You know, the holidays are coming. That would be an excellent gift to give yourself as well as to loved ones. And as always, I invite you to apply for a call with me. I would love to talk about this with you further. If you are struggling with that diagnosis, that label, and you feel constricted by it, let's chat about it. Let's see what other possibilities might be there for your healing journey. All of our information is in the show notes below. Reach out to both Ardeshir and I. And I thank you so much for supporting us and listening to this podcast. We will see you again next week with another new episode.